Hello, and welcome to this week's program of the Rotary E-Club of Silicon Valley. My name is Farheen, and I thank you all so much for joining us today. Each week, we connect with and hear from speakers who usually have a message focused on our love for innovation, entrepreneurship, and education. Today, we have David Campos, the Deputy County Executive and Public Information Officer for Santa Clara County. David will be discussing the current status of COVID-19, its impact on Santa Clara County, our community needs, and how the 2020 census has been impacted. With that said, David, please take it away.
Thank you very much. Thank you for the opportunity. Again, David Campos. I'm a Deputy County Executive, and right now during this pandemic, I serve as the lead Public Information Officer for the County of Santa Clara. And so we appreciate the opportunity to actually do this today and to share with you some information about the COVID-19 pandemic and how it has hit the County of Santa Clara. So let me begin by providing some context about COVID-19. And of course, this has been a national, worldwide pandemic. But when it comes to the United States, what we have learned is that the County of Santa Clara was in fact one of the first places to have COVID-19 present in the community. And in fact, the first reported case in the country, in the United States, took place in the County of Santa Clara. With that in mind, in some respects, it is not surprising that the County of Santa Clara has come to play a leading role in responding to COVID. And it was actually in this county where our public health officer, Dr. Sarah Cody, led not only the County of Santa Clara, but the region in the establishment and the issuance of the first shelter-in-place order. That shelter-in-place order essentially, for the first time anywhere in the country during the start of the pandemic, created a precedent for how to respond. And following the issuance of shelter in place by the County of Santa Clara, and then the 6 other jurisdictions in the Bay Area that followed suit, you had the state of California and then the rest of the country, and many that actually followed that lead. So Santa Clara County essentially led the way. And what is so critical about that is really understanding the challenge of doing that at the time, and how, when this is happening for the first time, there's a lot of fear of how to respond. And so a lot of credit has been given to Dr. Cody. And, if you actually look at what has happened because of that action, thousands of lives, not just in Santa Clara County, but throughout the state, throughout the country, were saved because of that action. So where are we today in terms of the COVID response? I think it's important to look at some of the numbers. And as you can see in this graph, starting in March when the first case was reported, and where we are today, you have seen that there has been an increase in the number of cases that have taken place. And that has been for a lot of different reasons. One of which, of course, is that, as you can see, around the time of May, April, and actually June in particular, that's when we started easing some of the restrictions that were in place. And as more of the economy, if you will, and the society opened up, you can see the number of cases increasing. Nevertheless, even though we have had COVID longer than just about any other jurisdiction in the country, you can see that right now we have 233 deaths in the county, which is much lower actually than most places. And in fact, the number of cases per capita in Santa Clara County is probably lower than most places, not just in the state, but actually in the rest of the country. I wanted to give an idea of sort of where the cases are taking place. And as you can see, that the distribution of cases depends, on a number of factors. And one of the things that we are seeing is, when it comes to race and ethnicity, is that there are some groups that have been disproportionately impacted by the virus. And specifically, if you look at the Latinx community. The Latinx community has been disproportionately impacted by COVID-19. In fact, right now the numbers are such where you have a community that has about 27% of the population is Latinx in the county of Santa Clara, and yet of the cases that are reported, about 61% of the cases that are currently reported are taking place in the Latinx community. And so if you can see here, so the Latinx community is 25.8% of the population and about 54.5% of the cases so far. That number, these are the total cases from the beginning of the pandemic. In terms of the more recent cases, the number is actually higher than 54, it's closer to 60%. And so as you can see, that this is something that, sorry, here you go, that is a real issue for us, because it means that something is happening in these communities. And by the way, with respect to the impact in some of these communities, we know that there are different factors why that is. One of them is, of course, the types of jobs that folks disproportionately have in these communities. So in the Latinx community, there's a large percentage of members of that community that are frontline workers and that are basically in jobs where they're not able to shelter in place. And so they actually have to go in and show up to work. And we know that the more you're exposed to the virus, the more likely you are to actually be, get infected. Likewise, we know that there are issues with the housing for some of these communities who end up living perhaps in smaller places where you have a larger number of people, where it's more difficult to actually, have the kind of social distancing and the space that's needed to actually protect yourself. You also look at the number of deaths. There's also a disproportionality in terms of the number of folks in those communities, in the Latinx community, for instance, and even in the African American community to some extent. I wanted to give you now a sense of the geographic area that is the county. That's a map of the county of Santa Clara. And as you can see, the darker the shade, the higher the concentration of cases is. And you can see in the middle of the map, that is the East San Jose part of the county. That's the county of Santa Clara has 2 million people. It has 15 cities. San Jose is about half the population, a little bit more than half of the population of the county. And there is a disproportionate impact in East San Jose. And then if you look at the southern part of the county, there's also, and this is the area of Gilroy, in particular Morgan Hill, there's also disproportionality there. This sort of shows the cases by city. And as you can see here, just about every city in the county has cases and has been impacted, even though the impact has been greater in South County, East San Jose. Now, as you can see here, this is a graph that shows hospital capacity. And one of the things that we have seen is that from the very beginning of the pandemic, going back to the start, as you may recall, there was a very real fear that we would run out of beds, a very real fear that we would not have enough intensive care unit beds, ICU beds, that we wouldn't have enough capacity in the system, ventilators and other things that were critical. And of course, because of the planning and the work that we have done, you can see that we actually have a great deal of capacity left in the system. That in fact, the number of beds available, and this is sort of the key number here, all beds available, over 1,000 beds that are available in the system. We have been able to essentially, provide the healthcare needed to be able to respond to the pandemic, and a great deal of that is because of the swift action that was taken. So let me stop the slides and now talk about where we are today with COVID-19. And the reality is that today we have in Santa Clara County as good a situation as any jurisdiction in the state of California. Our case count per capita is lower than just about anywhere else. I think that Santa Clara County, San Francisco have some of the lowest number of cases per capita. Our infection rate is also lower than the rest of the state. That said, you also find that the virus is still present, and it's especially present in communities like East San Jose, like South County. So what is the county doing right now? We are really redoubling our efforts to educate the public, because what we have done since the issuance of the shelter-in-place order is that we have shifted our focus into what we're calling risk reduction. And this risk reduction approach is one that basically says, look, COVID is going to be with us for quite some time. Until we have a vaccine, we're going to have to figure out how we cope with it on a long-term basis. And from a medicine science perspective, the best way to do that is for us to reduce the risks by how we engage, how we act as individuals and as businesses. And so that means, taking actions that reduce the risk. So that means for the individual, you have to wear face covering. That's really critical to prevent the transmission. You have to keep your social distancing. And for businesses, you have to follow certain protocols and procedures to make sure that you keep your workers and your customers safe. And then in addition to that, we're also focusing on communities like East San Jose, South County, to make sure that they have the tools to know how to protect themselves. So there are added efforts to educate these communities, to make sure that they know that they have been impacted disproportionately, and that they have an added responsibility to keep themselves safe because of that disproportionate impact. And so we're working with community-based organizations to go on the ground, actually knocking on doors in a safe way, keeping social distancing, so that we can educate these communities in their languages about the challenges and how to protect themselves. We're also giving them additional resources. Now, let me talk a little bit about, as that effort is going, we also have the census. And the census, as we know, is something that happens every 10 years. And, it is something that impacts communities and across the country for a long time. The census is used to determine political representation, to determine the level of funding that is provided to a jurisdiction. And what we're seeing with the census is that even though Santa Clara has made a huge investment, and we've invested more money than just about any local jurisdiction on the census, about $6 million for the last 3 years on our efforts to get people in the census. The positive thing is that investment has paid off in many respects. We have, I think, one of the top 3 responses of any county in the state, even though we are the 9th hardest to count county in the country because of our diversity, because of our geographic characteristics. But what we're finding is that even though we have a high response rate across the board, in certain communities, our response rate is lower. And interestingly enough, the same communities where that is the case are in East San Jose, South County. And so we need to, as we are educating these communities about the need to protect themselves from COVID, we also, need to do what we can to educate them about the importance of the census. And COVID and the census are related, because in many respects, the challenge of COVID makes it more difficult for people to think about the census. But in some respects, the challenge of COVID makes the census even more important, right? Because the census is how the federal government determines how much to give us in resources. And so this is, in many respects, a perfect storm in terms of the challenges faced by a place like Santa Clara County, that you have a pandemic, and in the middle of this pandemic, you have this critical effort of the census. But we're very proud of how we are dealing with this. We are proud that we have led the country in many respects in the response to COVID. And we're very proud that we're also leading the state in the response, not just to COVID, but also the census. And in a way, I think that it makes sense that it would be Silicon Valley a place of innovation, innovation when it comes to technology, that would have that innovation and know-how to do the right thing when it comes to these two big challenges, COVID-19 and the 2020 census. So I will end my presentation with that and happy to take questions.
Great, thank you so much, David, for your presentation. I learned a lot. And I have quite a few questions to ask you, as does Cecilia, but first I want to introduce her. Cecilia is our Vice President, and I believe she recently moved, but I hope she's still in Santa Clara County. Cecilia, are you still here?
I'm in Sunnyvale, so yes, I'm still in the county. It's only temporary, but I'm taking care of some friends. I'm technically homeless because I was a Peace Corps volunteer who was evacuated back to my home of record, which is here in Santa Clara County. And it's been very interesting to watch not only what's going on here, but by comparison, what's going on in Ethiopia, which is, as you know, a very underdeveloped country, but in which they have 110 million people, and so far about 30,000 cases with 300 deaths. So, and they have contact traced half of their population. I mean, it's amazing what they have done and how well they've kept this under control. But there are other things. So I have been very involved in the Rotary Foundation grant program. I don't know if you're a Rotarian or not, but I was the grants chair here in the district and the Rotary Foundation committee chair here in the district for about 15 years total. And so the minute I hit the ground when I came back, clubs who became aware of that started asking me for advice, because the foundation has loosened its requirements, its sustainability requirements, so that clubs can do COVID-19 projects and get them approved more quickly, because obviously if they wait around too long, the need will pass. I mean, we hope it will pass. I hope it will pass. Because there'll be a vaccine or a treatment, or maybe eventually herd immunity. But so I'm working with the Rotary Club of Saratoga, and you might be interested to know what they're working on. They're working on a grant that will provide a refrigerated truck. And normally the Rotary Foundation would be like, no vehicles. We are not going to grant money to organizations buying vehicles, but they are working with Martha's Kitchen, which I'm sure you've heard about, and also I think it's called Healing Grove. And they're working heavily in the Latinx community. And so your talk really excited me, because I could and I will suggest that they use the outreach that they're going to be able to do with this truck to not only provide, they're going to provide health screenings from the truck itself, and eventually vaccinations, because if there is a vaccine, obviously it has to get out to people. But they could also be instrumental in helping with those that are hard to reach for the census, and also for voter registration. And those that are eligible to vote. That community, as you know, there are a lot of people that are undocumented, and that's probably largely the reason why they don't just come forward. I mean, in addition to they are frontline workers, they're not generally often insured or not adequately insured. So this project could fill that gap, at least somewhat. And so I will talk to them. I'm attending all of their grant planning meetings, and I will talk to them about that, because the Rotary Foundation would love to see that, I'm sure, as part of the use of their that vehicle for the outreach. So can I, or should I have them contact you?
Because, yes, please. Definitely have them contact me. We really welcome the opportunity to work with them. We really need partners with respect to both COVID and the census, because at the end of the day, it's not just the county that needs to be out there, but it's trusted partners that people, have faith in, like the Rotary Club, and so we welcome that opportunity, and happy to provide the contact information so that happens.
Okay, well, I will definitely do that. And, all Rotary clubs now are meeting virtually because Rotary International has said no physical meetings until the pandemic passes.
Of course.
So
Yes.
I'm sure they would love to hear from you. And
Okay.
so I will
Wonderful.
make sure that they get your contact information. I just think this is a wonderful opportunity that they would not have known about and you would not have known about. And here we are, and this is true around the world. I see it everywhere. We've got all kinds of organizations working in different areas, and often they do overlapping work, but nobody keeps track of who's doing what. And so, a coordinated effort would be a great thing here. So that's
Absolutely.
my pledge to you. I'll do that this week.
Thank you. We welcome
Sure.
that. Thank you.
Sure.
Thank you, Cecilia. So David, I have a question in terms of, so for me as, a citizen of Santa Clara County, I have been, doing my best with social distancing, with not going out unless I really have to, with wearing a mask everywhere I go. So, and is there I guess my question is there anything else I can do to help, prevent the spread of COVID-19?
Well, I think that, information is key with something like a pandemic. And I think that speaking to your friends, to your relatives, to your network, I mean, you'll be amazed how many people you actually know and actually connect with. And I think that stressing and highlighting the fact that as much as we have had a lot of success, that this is still very present is important. I think that, having conversations about not just the virus and the disease, but also just the challenge that it's been for us to cope with COVID. We have been dealing with COVID for more than 6 months. And there is an impact that goes beyond the health, but it's also a psychological impact, a financial impact. And I think that what I think gets us through something as challenging as this is a sense of community, and shared purpose. And I think being able to share, your own challenges and your own struggles is something that lifts people up. And I think that the more we talk about it and the more we're open about it, the better and easier it is, because we're all connected. The reality is that for us to be able to get through, we're going to have to do it together, because, that's just the way, Mother Nature operates when it comes to something like this.
Right.
Totally. Thank you. No, that makes a lot of sense. And also I'm curious, are there any kind of volunteer opportunities for citizens to partake with the Santa Clara County Public Health Department?
Absolutely. And in fact, I would encourage you and your members to call 211, which is the main public information hotline for the county. And one of the things that the county is doing is that we are always seeking volunteers. And for instance, we actually have a large number of volunteers who are helping with the effort on contact tracing, to be able to trace the contacts of every person who tests positive, and then the people that they had contact with. We need a workforce and volunteer force of about 1,000 people, and we actually have been able to recruit that many, and that's a testament to the sense of purpose and the social responsibility that people have in this community. And there are also opportunities, to help with your local food bank, to help with a lot of different, responses, parts of the response. And that's one thing I love about Santa Clara County, is the fact that there is that sense of community that people have.
Absolutely. Yeah, thank you. And I really hope whoever is watching this recording, Rotarian or not Rotarian, Santa Clara County resident or not, that, that we all pitch in and help, because it's really important. And I think especially as a Rotarian, I mean, I'm always looking for ways that I can help my community, and I think this is definitely one that I hope to be able to do. And then
Absolutely.
actually, I have one last question. I know that in some countries, like in Japan and I think Korea, they have applications that allow you to do contact tracing. Is that something that we are looking into in this country, or?
Well, we have Silicon Valley. We're in the heart of Silicon Valley here, right? So that the heart of it's the technology capital of the world. So that we are working with Google and other companies to develop those tools, and so that is happening. But I think that the thing about technology is that even technology as advanced as it can be has its own limitations, right? And the thing about contact tracing or testing or whatever it is really is about that personal relationship. What works with contact tracing is when people have people from the community helping them, workers that live in the county, volunteers that come from the county, so that people feel like, when they get that contact, that it's a source that can be trusted, right? And that's one of the things that we're very proud of as a county. I think that one of the reasons we've been able to respond as effectively as we have is because there is trust in the county. As was said by Cecilia before, there are some communities who don't trust government, right? If you're undocumented, you're not going to trust the federal government, but you actually might trust the county, because the county, beyond even before COVID, before the census, we've been investing millions of dollars in our immigrant communities, to provide legal assistance, to provide different kinds of support. And so that record and of commitment, comes in handy with something like this, because there is trust in the response that the county is leading.
Absolutely. Yeah,
That's great. Sorry. I took a 35-hour, it was offered through a partnership between Rotary International and the Yale School of Public Health course, which did not include contact tracing. They have one that's 10 hours that I'm thinking about taking. And that's one of my questions is, to do that work for the county, do you have to have had that training, or do you train people, or how does that work for those of us that want to know?
Sure. I mean, I think that there are certain skills that are sought for contact tracers, and having a background in health is something that is really important. But contact tracing is a piece of it, because it's not just the contact tracers, but it's actually the support infrastructure that comes with it. It's not just volunteers to help with contact tracing, but also people who can help us follow up with the people that are contacted, so that they have housing, they have food, they have other support systems that are needed. It's not just about telling people, by the way, you are positive, but you also have to give people the tools to actually take care of themselves. And we're proud of the fact that in Santa Clara County, if you're contacted and you live in a crowded space and you can't socially distance and isolate yourself, you can't quarantine in your house or in your apartment, we give you a hotel room where you can go and take care of yourself for the 14 days that you need to be quarantined. Likewise, if you have no way of buying food, or we don't want you to go out if you're positive, we bring the food to you. So we are doing those things because we know that in the end, we need to be there for our citizens, for our residents, and we do that irrespective of whether you have insurance, whether you have documentation, your legal status, your immigration status. Likewise with testing, we test everyone, and we have systems in place and pop-up testing sites throughout the county in different languages. We have more than 50 sites that are provided to test people, and no questions asked whether you're symptomatic or not. And that's the kind of approach that we've taken. Why I think it's been effective.
Yeah, absolutely. So, Cecilia, do you have any other questions? If not, we will wrap up and then end the recording here.
Okay, so I don't think I have any other questions. I will put the Rotary Club of Saratoga in contact with you, because I think bringing in the county as an additional partner, no matter how tangential, will help them raise the money for this vehicle more quickly. So
Wonderful.
thank
you
you.
for the opportunity.
Sure, thank you.
So seeing as there are no more questions or comments, so Rotary members and guests, please make sure you fill out the attendance section and leave us a comment. Also, if you have an awesome idea for a program, please use the link below to submit your ideas. Thank you again, David, and I will turn it back to you for your final words.
I simply want to thank the Rotary Club and all the Rotarians that will be watching this video for the opportunity to address you. It is a very challenging time with COVID, with the census. In the last few days, the County of Santa Clara has also been dealing with many fires. And the thing about these challenging times is that it is really difficult, but they also bring out the best in people. And that's what's so beautiful to watch and see across the board in the County of Santa Clara. 2 million people, that as challenging as it is, have come together, have pulled through, and are really showing the rest of the state, the rest of the country, how it's done in Silicon Valley. And the fact is that as challenging as this time is, we're going to get through it. We're going to get through it because that's what we have done before. And, we are a community that knows how. And I'm just very proud and grateful to every resident of this county for the sacrifices that they have made to get us to where we are. And we just have to hang in there and continue to have hope in each other.
Perfect. Thank you so much, David, and I will see everyone else next week.
Thank you.